Good morning. I'm Mike Neal, President and CEO of the Tulsa Regional Chamber. Welcome to today's Business Support Series webinar, episode 12. We at the Chamber are delighted to sponsor this Business Support Series, offering insights on how your organization can effectively respond to the COVID-19 pandemic. There's an area where the Chamber can be of assistance to you. Please let me know personally. Please feel free to let any member of our staff know. Our conversation today will focus on the importance of prioritizing mental and emotional health during the pandemic. But before we get to our speakers, I'd like to thank the sponsors of our Business Support Series, Expert Ready, Luxa Enterprises, Security Bank, and Stride Bank. We're pleased to have with us Frauke Quiroga, CEO and Managing Partner of Luxa Enterprises, distinguished member of both our Tulsa Regional Chamber and Tulsa Regional Tourism Board of Directors. And I'll now pass it over to Frauke to introduce today's speakers. Frauke?
Thank you, Mike. Good morning, everyone. It's an honor to join everyone today and introduce our speakers. Gail Lapidus, CEO of Family and Children's Services. She has more than 40 years of experience in the field of human services and has served as the agency's executive director since 1986. And I'm a huge admirer of hers. Zack Stoycoff is Senior Director of Policy and Planning for the Healthy Minds Policy Initiative. Zack has more than a decade of experience researching, analyzing, and advancing public policy in Oklahoma. Before leading the Healthy Minds organization, Zack worked at the Tulsa Regional Chamber as Vice President of Government Affairs. Thank you for joining today. Please share with us your perspective on the COVID-19 pandemic and how it's affecting families and the workforce, starting with Zack.
All right, well, thank you, Frauke. Thank you, Mike. And I'd really like to thank the Tulsa Regional Chamber for hosting this conversation. Obviously, mental health has a significant impact regarding COVID and certainly for our employers in town. And I'll tell you a little bit about briefly Healthy Minds Policy Initiative and jump into some of our data and what we've looked at. Healthy Minds Policy Initiative is a nonpartisan, data-driven policy organization funded by the Ann and Henry Zero Foundation last year as an extension of the foundation's investment in the 10-year Tulsa Mental Health Plan from the year before. We are really here to support policymakers and community leaders in driving forward evidence-based, data-driven mental health policies to reduce the devastating impact of untreated mental illness and substance use disorders on our communities. And briefly, we do know that mental health is a concern for businesses and the economy, even in the best of times. National studies have shown that nearly $200 billion has been lost in annual earnings due to untreated mental illness alone. We know that untreated depression, for example, results in an average of about a month, about 31 days, where somebody would need to leave work and not work, and almost another 30 days and just lost productivity from that condition. It's sort of intuitive. We all know if an employee is sick, if somebody is ill, their productivity, their ability to be at work will be compromised. And certainly with mental health, that is definitely the case. And I want to emphasize, you know, there's a tendency to think about mental health in terms of serious mental illness, schizophrenia, bipolar disorder. But what we're really talking about also is things like anxiety and depression, things that we're all feeling even right now often as a result of these stay-at-home orders, as a result of COVID stress. In a normal year, 1 in 5 adults experience mental illness. It is estimated that in Oklahoma alone, 86 out of 1,000 employees is affected by depression itself, just alone depression. So this is certainly an issue that companies should be looking at, both in terms of employee wellness programs, talking with their insurer about what is covered, what are my employees doing, and getting treatment, because we know that treatment works. We know that treatment works. We know that for every $1 invested in employee mental health, there is a $4 ROI in present and future employee productivity. This is real, and our companies can really help with their own profits and productivity and ensuring that their employees are well. Really, with regards to COVID, we are seeing nationally, you may have seen some news stories, that COVID, really the second wave of this crisis will be around mental health. We all know we're experiencing stress. We all know The individuals with serious mental illness may have exacerbated situations that stem from their underlying mental condition, but because of the stress. And we know there's a host of evidence based on even the 2008-2009 economic recession, that economic recessions will have mental health ramifications. So there's sort of two lines of thinking here with COVID. One is it's a natural disaster. One is it's like the Oklahoma City bombing or 9/11 or any kind of disaster that may impact large populations. The impact goes beyond the individuals who experience a direct disaster itself. The impact lasts long after things are rebuilt. The impact is in mental health. So in COVID, the situation's a little bit interesting. We are all impacted in some way by COVID. We are all having our lives changed in some way by COVID. Whether you're a child whose parent is stressed or you're having to stay at home, or whether someone you love is actually infected by COVID, there's a stress that goes along with that. And there are certainly methodologies that can measure the impact of that natural disaster on mental health that we need to be considering from a policy perspective. And the other side of this is really the economic downturn. We've seen oil, for example, go negative, and the impacts of that on the Oklahoma economy can't be understated. We know that in the 2008-2009 recession, there were a number of factors that resulted from economic downturn, financial hardship on families. One being increased suicide ideation, increased thoughts and attempts in suicide. Addiction increases, so individuals developing substance use disorders for illicit drugs. Childhood trauma, all of these things are going to play a role in our community's impact here resulting from this COVID disaster. And so I'll go through a few of the sort of the ways that we've tried to quantify this from a Healthy Minds perspective, really to help inform our community as a whole, and really our policymakers, state lawmakers, on how we need to be addressing this so that we can get back on our feet when the economy is back in order, so that our individuals can contribute productively and have healthy, productive lives. And some of these numbers are rather shocking, and you may have seen a few of these reports in the media a couple of weeks ago when we released our original projections on the mental health impacts of COVID. We've actually just updated those projections. Those numbers will go live on our website later today, so you are hearing a little bit more of the ultra latest here around these numbers based on observed economic data, not just projections. So based on that new data, we really do estimate that hundreds of Oklahomans could die from behavioral health issues that are directly related to COVID. These are COVID-related deaths as much as the infection itself. We estimate that as many as 260 additional deaths from opioid overdoses and suicide alone could occur. If unemployment reaches as high as some experts predict, we could be looking at as much as 700 deaths in those categories. In the realm of suicide ideation, we know that potentially as many as 34,000 Oklahomans may experience suicidal thoughts in the coming year because of this economic downturn, and that almost 10,000 of them, in fact 9,400 of them exactly, may attempt suicide. That's without some sort of additional proactive intervention from a policy and a funding level. If unemployment reaches as high as some experts predict, some experts do predict as much as 30% unemployment, those numbers would skyrocket and very unfortunately could be as high as 100,000 Oklahomans experiencing suicidal thoughts. We know that childhood trauma is another significant issue that will have ramifications for many years to come, We know that childhood trauma is a significant cause of onset of mental illness and even serious mental illness later in life. And so according to some studies of pandemics, as many as 30% of children who are involved in an actual quarantine may experience diagnosable post-traumatic stress disorder, PTSD symptoms that would be diagnosable. Now, the distinction there is that's children who are in quarantine, not just children who are in social distancing, but there certainly is some trauma associated with that. Gail can certainly talk more about that, but when you start looking at issues like child abuse and domestic violence and the trauma that's associated with that, when you start looking at not going to school and your situation disrupted, your routine disrupted, there will be childhood mental health ramifications there, and we need to be looking at investing in our schools and our children's mental health resources to accommodate that need. And then finally, drug addiction. Drug addiction is a significant issue in our state. We all know that. We all know that Oklahoma was really hit hard by the opioid crisis, but we are projecting that as a result of this situation, as many as 14,000 Oklahomans may develop an illicit drug use disorder such as opioid addiction. And we know that as many as 4,500 Oklahomans may develop alcohol use disorder. And all of those numbers, of course, are in addition to baseline. So these are all COVID-related projections of what our need could be in Oklahoma moving forward. And I want to close because I know Gail is going to talk a little bit about what employers specifically can do, but Healthy Minds organization is an advocacy organization, and I will tell you that through organizations like the Tulsa Regional Chamber and associations that represent you, you really can have a difference in ensuring that the appropriate policy interventions are in place to offset some of these situations that we'll face. So for example, are we keeping the Department of Mental Health's budget as whole as we possibly can, even through the state budget shortfall that we know is coming? And the key reason for that really is economic, because if we're not addressing that mental health condition arising from all of this trauma, we really aren't gonna have, we're really gonna be handcuffing ourselves truly in our ability to recover from this economic recession. Individuals won't be able to get back to work, won't be as productive as they possibly can. Our economy will lag as a result of this mental health crisis. Thank you for your time, and happy to answer questions at the end of the presentations.
Thank you.
Okay, this
Thank
is
you so much, Gail.
okay. My name is Gail Lapidus. I'm the CEO of Family and Children's Services, and I'm honored to be presenting with Zack for the Chamber. I do want to give the Chamber a big shout out. I was on a national call yesterday with mental health centers from all over the United States and their medical director. And one of the first and most important things he said is that, you know, our country is better because many chambers of commerce around the United States have chosen to come out loud in different cities promoting the importance of mental health. So we thank you as a local partner of yours for doing such here in Tulsa. I think people are agreeing that mental health now is becoming one of the most important issues. And in the same way that I think technology has been a primary hero in this COVID response for allowing our nation to go forward, I think that employers are the other secret hero here. And the role that employers can play is vital in helping our nation's employee groups get back and feel the support of their employer. So I'm going to do a quick PowerPoint this morning. I'm going to talk about why employees are paying attention to mental health, what's going on with your employees that you're not seeing every day, and what employers can do different that could make a big impact in mitigating against this trauma of COVID. So I'm going to start by just reminding everybody that what we already know, that the magnitude of disruption in our lives is unprecedented. And without a clear end in sight, we get our stress and anxiety exacerbated. Like if we knew COVID was getting on a plane Friday and leaving town, we wouldn't have a mental health distress, but we do not know when we're going to be safe. We do not know when it's going to be over. And most people just don't, even with the best of mental health, do not do well with prolonged uncertainty. And what this is creating in many people is this feeling of worry 24/7. Your employees are home or in the office worrying about getting sick. They're worried if their loved ones are going to get sick. They're mostly worried about their job security, and I'm going to get into that more in a moment. Now about the oil and gas prices plunging, about their partner's unemployment. They worry about what's happening to their children because they're not being properly educated or maybe even being well taken care of because the parents are trying to balance their work responsibilities with their child responsibilities. And I think people are worried what this prolonged isolation is going to mean for people. So everything about our well-being, our personalities, the ways we live and cope is magnified during this pandemic. And it is the perfect storm for mental health challenges to start erupting in people's lives. The latest polls released yesterday said 40 to 45% of adults in the United States report that their mental health has already been negatively impacted. And we know as the burden increases, there'll be greater isolation and potential financial distress. And we do know, and I know businesses for sure know this, is that there's a direct correlation between financial distress, and mental health, leading to depression and often to suicide. So our call to action is, as employers are wrestling with these business continuity planning that we're all having to do, that you should consider employee mental health and their well-being support a critical aspect of your continuity plan. And employees are going through a lot, and I'm going to share some of that right now, and they look to their employer to help them get through it. So you can leave this slide up for another minute. So I went online, and I also went through our hotline on COVID and interviewed about 125 of our employees through this supervisory group to say, what are you all worried about? What's going on inside your minds? Well, it's mostly about their job, which really surprised me. I wasn't sure. I thought we've given a great sense of communication, but still yet, people are worried. Am I going to get furloughed? What will that mean? Will I have benefits? I just bought a house. Am I going to lose it? Am I going to lose my job? Will my husband lose my job? What is going to happen to me? Because all the data suggests this is going to go on, come back. Some say in the fall, some say in the winter. And I learned and got it confirmed this morning that because of this recent conversation happening at the governor level and at the national level about preparedness for going back to work, that your average employee out there is worried that work is going to come back online at a much faster pace than childcare, summer camps, and school. So I just thought it would be good for all employers to realize, like, that's what's foremost on your employee's mind. Like, what if I get called back to work and I'm a single parent? I don't have anybody to come in and watch my kids, and schools are still closed, daycares are still closed, summer pools are probably going to stay closed, and there probably won't be any summer camp. These are real threats on individuals' lives, their well-being with their family, and there aren't any clear answers for that. Also, employees are wondering, when I do get called back to work, is my employer going to care about my safety? Are they going to provide with enough social distancing? Are they going to have enough disinfectants around? Or are they going to expect a different environment like it was before? So I think, you know, when we talk to people around the country, and it seems like the biggest burden people are feeling is this constant pressure of feeling like they're letting down their employer because they can't complete a full 8-hour job. The dog is barking, as you can see on the screen. The baby's on the lap. The little one is wanting help. The teenagers are trying to, you know, chat all day or sleep all day. It's very, very hard. So many parents are feeling the burden, feeling bad that they're not doing a good job parenting, and they're not doing the kind of job they want to do for their employer. And you can change the slide, please. So they're worried. They're worried about catching the virus, about their kids catching the virus. Some of the new studies and evidence is showing a lot of couples are worrying that what they thought was at least an okay marriage now doesn't seem like an okay marriage anymore. Relationships are being very strained and stressed. And at the start of COVID, people didn't know what this would be like to have this much contact in a home without the outside world coming in and out. Zack made reference to addiction issues, and we know from all the programs we run on addiction usually starts as an effort for somebody to sort of numb their pain, give them some alcohol to relax, and then we know that people are very stressed out now, so they probably, if you have a propensity to like alcohol, probably people very worried that they are drinking too much or somebody else they love is drinking too much. Many parents are worried about their children. All of the year-end proms and high school graduations, college job offers, everything has been put on hold, and there's tremendous distress about that. And we know that parents are having a hard time knowing how to distinguish between a misbehaving child and a child who is very depressed themselves. And in families, you have a lot of kids who are upset. And when kids are upset, they don't usually say it in words. They usually act up or act out or don't mind or get in your way. So parents having a tendency to maybe be harsher with their children, not knowing how to differentiate between what is my child's doing that's maybe an expression of their depression versus driving me crazy. So we as one agency and others are trying to pump out tons of information to help parents, you know, really deal with all of this. You can change the slide now. So very quickly, there's many things that employers could do. You are the most significant player in our employees' world right now, and they need to know that you are aware of how hard they are trying to balance this work with caring for their children and worrying about what's going to happen for children on into the future. So employers do have the opportunity to be the hero in this story and really help employees with their mental health and overall well-being. And you could flip the slide, please. So I just have a few hints. Number one hint, double down on communication. There is nothing better than for an employer to do right now is to communicate, communicate, and communicate. Use your different channels you have, whether you talk to your employees through emails or on corporate websites or in shout outs or video presentations. You can't communicate too much, expressing your concern for everybody, as well as giving them updated information meaningful to your particular company. So I know many companies have increased their supervisory contact, anybody in management sort of reaching out and having very much frequent communication with their employees. Next slide, please. I think everybody should openly address mental health needs in their companies. I'll tell you quickly the 3 different groups so that you don't think of this as one giant thing. One group, newly affected people. It could be anybody in your company that under ordinary circumstances, they never had mental health worries, they never have been in treatment before, and suddenly under this extraordinary circumstance, with their regular coping skills sort of stolen away from them, they're having a harder time. So this group of people, they used to go socialize after work, they went to the gym, there's no after work gatherings, they hadn't dropped out of classes, they're worried about money and don't have anything to sort of help them typically cope. So that's the newest group, they're newly affected. Then the second and third group are people who have different kind of stressors. So the second group are people who have known mental health illness, mental health problems, they're in treatment, they're on medicine, and as with any crisis, this group of individuals is going to feel more stress and it might exacerbate any pre-existing mental health condition. And then the third group in here are people who are going through extraordinary grief, loss, or transition. They may never have had a mental health issue. They're going through all of the same issues adapting to COVID, but their mother just died and they weren't allowed to grieve and go up and to say goodbye. They had to have a remote funeral. Or people who have just recently moved to Tulsa and they're isolated. Or children who are reactivating now as adults from their earlier childhood experiences, and others having PTSD from an earlier disastrous experience, like, for example, 9/11, Oklahoma City bombing in particular to Oklahoma. Next slide, please. So it's real, oops, there should be one more now. Okay, I'll do this one, hopefully. There you go. Let employees know how to seek professional help. It was just up a second ago. There you go. Okay, so given all of that, I think it'd be terrific if employers just started promoting how to get professional help, whether you have a long-standing condition or it's brand new. You know how to make mental health referrals in your companies. Maybe you use your EAP, maybe it's supervisory, maybe it's through your mental health covered benefits. But I promote it out there, letting people know it's normal, take advantage of it. Some companies have peer-to-peer groups that are checking on people. Everybody should in the community, it's free and available for the community, is the COPE's phone number. They answer 24/7 for psychiatric emergencies, 918-744-4800. That's a number employers always need to have around. Next slide, please. This was one that I know when we've talked to our employees, they would say the biggest thing my employer could do for me is understand I've got 4 kids here and I need flexibility with my hours that I'm working. So unless I have to be on a team call, is it okay if I do my payable work from 8 to midnight when my kids are sleeping? I know some employers are being very flexible, others aren't, but it's something that would show compassion as they're trying to juggle all of these things. And it is especially difficult for families with young children to be able to do all their work while they're looking after their kids. Next slide, please. Some of you that have a kind, compassionate heart, I would suggest that employers could be the person in the life of these employees who are in isolation. If you know employees that are living by themselves or had to put themselves in isolation or quarantine, lend an extra hand, reach out, make sure somebody in the company is assigned to stay in touch with this person. This group is very high risk for developing pretty difficult, complex mental health disorders. Next slide.
Gail, we got about 10 more seconds.
Okay, so this one is, there is a million community resources out there. They're on the Family and Children's website, anything from how to, not just mental health, but how to get food, what to do if your landlord's trying to evict you, financial resources. There's many ways companies can link to 211, very simple resource, just so that you can provide that link to address some of those issues. And my last thing I was going to say, because I have run out of time, is employers need to be kind to themselves, because we have the burden, not just like everybody else has, but employers are leading companies and they're carrying the burden of the financial risks involved in the viability of their own companies. That's a tremendous burden, tremendous stress. So every employer involved out there, you got to give yourself a break.
Gail, thank you. Zach, thank you. We've got just about 2 minutes remaining. Time for one final question from Frauke to Zach.
Sure, thank you. So can you tell us more about maybe what employers should start considering adding to their insurance plans to support employees' mental health?
Sure. Well, the number one thing would be to ask their insurer about parity compliance. Mental health parity is the concept that physical and mental health care are treated the same, and there are no greater restrictions placed on obtaining mental health care. So this is your insurer charging copays that they're not charging for physical health, quote unquote, physical health treatment on their mental health side, things like that. You can also really talk to your insurance plan about what proactive measures are there to fund mental health treatment. Ask them about the collaborative care model, which is sort of a jargony way to say, are you ensuring that in primary care our employees are actually receiving mental health screening and that the providers are talking to each other about the mental health treatment? We do know that a majority of individuals a significant percentage of individuals who commit suicide had actually seen a primary care physician in relatively recent months. So that is a significant place where we can start really identifying early these challenges.
Zach, thank you so very much. A special thank you to Gail, to Zach and Frauke for joining us today. I'd like to once again thank Luxa Enterprises, Expert Ready, Security Bank, and Stride Bank for their support of the series. Anyone who joined us late, whether you called in or via the webinar, a recording will be posted on the Chamber's website later today. Please feel free to direct anybody to that or share that with anybody. Our next business support series webinar will be next Tuesday, April the 28th at 11 a.m. when we'll be joined by Dr. Timothy Young, the Chief Clinical Officer for Ascension St. John, for a 30-minute discussion and analysis of the latest medical trends. As you heard, the governor's announcement as to his desires for reopening our state yesterday, our Mayor's Business Recovery Task Force that's being done in collaboration with the Chamber meets for the first time this afternoon. The mayor will be having some announcements tomorrow at lunch himself. And so we look forward to having more in-depth medical discussion as to what's happening in our area from a medical perspective and how we can ensure the safety and security of all our employees as well as our citizens. And so please feel free to go to the Chamber website, tulsachamber.com/events to register for that webinar. Also, if there's anything at all that our team or I can do personally to assist you and your company, please feel free to reach out directly to us. I'll also tell you that the Tomorrow, we're doing our first ever remote Tulsa Chamber State Capitol Luncheon remotely tomorrow at 12 noon. And I think next Monday, we're doing our first ever congressional forum live, remotely that is, with U.S. Senator James Lankford. So again, all those events can be accessed and registered for via the Chamber website. We're trying to keep good programming such as what Gail and Zack have provided today coming to our members on a continual basis. Thank you. Have a great day and a wonderful weekend as well. Thank you.